So hello guys, today we're going to talk about frozen shoulder and 3 signs to keep an eye on. So the first sign to keep an eye on is pain and stiffness. As for the pain might be there in the first 3 phases of frozen shoulder. So initially you might get pain and your complete range of motion. In the second phase you might get pain and decrease or no range of movement whatsoever. In the third phase you might get just the pain as the range of movement is coming back. As for the stiffness is typical of the second and third phase, when you start having less range of motion or no range of motion, and when you start to get your range of motion back but you're still having some pain and struggles to move your shoulder. So the second typical sign of a frozen shoulder normally is having little or no range of movement whatsoever. It is typical of a frozen shoulder, especially of the second and third phase, when you basically start to have the movement back in the third phase and when you have kind of no movement in the second phase. Reason being, frozen shoulder being adhesive capsulitis of your shoulder, so basically targeting the capsule around your joint, basically is kind of compressing your joint altogether, so it's not letting your shoulder move at all. And in fact, one of the key elements for a diagnosis of frozen shoulder is making sure that the patient is not able to do any type of movement. Until the patient is able to do all the movements, or even one movement, even overhead, like with a flexion motion or an abduction motion, you can't really diagnose a frozen shoulder. And lastly, the third sign of a frozen shoulder is pain during the night. Pain during the night, because frozen shoulder being an inflammatory disease, as is typical pain during the night as all the other inflammatory disease. So as your shoulder is not moving around a lot, so all the blood and inflammatory substances in the blood are basically staying locally and not moving around your body, you can get more pain and you can feel more pain during the night even though you're not moving or you're not doing anything specifically. Of course, if you're a side sleeper, it's even worse because you might end up sleeping on that side, though creating even more pain. So thank you guys for watching. If you like this video or found it informative, please leave a like and subscribe, and see you in the next one.